Federal and local leaders are trying to address the possibility that an overwhelming number of people could need ICU care with limited access to ventilators.
We are prepared to distribute to HHS up to 2,000 deployable ventilators for use as needed. These machines are different from their civilian equivalents and require special training to operate.
A profound shortage of healthcare workers who can operate mechanical ventilators could be a significant problem for American hospitals. That's according to a report from the Society of Critical Care Medicine. KCTV5's Emily Rittman has a closer look.
As each new local case of COVID-19 is confirmed, treatment begins for each patient. For patients with severe respiratory failure who need ICU care, ventilators could mean the difference between life and death.
We have enough to cover all the patients who need them in the United States right now. We have capacity to surge for an increased number of patients.
As we see healthcare systems overwhelmed in Italy, here at home in the U.S., the American Hospital Association projects 4.8 million patients will be hospitalized and 960,000 will require mechanical ventilation.
There's the potential for not having enough ventilators, but it is entirely dependent upon the number of patients we get. So we have the capacity for about 200,000 ventilators using creative methods of getting additional ventilators.
Craig Coopersmith, the interim director of Emory Critical Care Center in Georgia, spoke to KCTV5 News via Skype. He is the past president of the Society of Critical Care Medicine. That group released a recent report that found while more than 200,000 mechanical ventilators may be available in the U.S., the number of patients who can be ventilated could be significantly lower due to the number of professionals trained to operate them.
What's unclear is how many patients we're going to get and how many of those patients are going to require ventilators. And also how many of those patients are going to require ventilators at a certain time. There's a difference between having a sustained number of months that we need patients on the ventilators versus a peak.
Coopersmith says hospitals can expand their capacity to treat COVID-19 patients by canceling elective surgeries and reallocating healthcare providers, including surgeons and anesthesiologists. Robert Preville, the CEO of Quipt, an online business-to-business equipment rental marketplace that rents and finances ventilators, spoke to KCTV5 News via Skype.
This is quite different. We're seeing a huge surge in ventilator requests. We've probably taken 30 plus requests in the last several days, and each of those requests are hospitals and medical centers, and they're typically requesting, say, 10 to up to 200 ventilators at a time.
We reached out to state health departments in Kansas and Missouri. The Missouri Department of Health and Senior Services said Missouri's most recent query found 17% of hospitals' ventilators were currently in use. Missouri maintains a state-owned cache of approximately 125 portable ventilators that can be deployed if needed. Purchasing additional ventilators will be a consideration with emergency federal funding. We are still waiting to hear back from Kansas officials. Emily Rittman, KCTV5 News.